Since Dr. Saad Liamani approached me to take part in this meeting, I thought it will be good to bring some clinical material from the region for both our colleague in Saudi Arabia and as well as from colleague from other parts of the world. So I agreed with a colleague from pediatric neurology to do a joint effort and present something to this conference. Unfortunately, the data was not complete for pediatric neurology, so today I'm going to present only the data from child psychiatry. I'm going to talk about the impairment as an assessment of outcome of treatment, which is different from the first speaker who was talking about impairment in other areas and the cost of impairment or the burden of impairment on society. I think everybody here knows that the presence of impairment is a requirement not just for ADHD but for all mental disorder. That an evidence of impairment in living or at work and relationship should be present before you can reach to diagnosis. And thinking about ADHD and impairment, I was looking into the literature and seems that there are some tools that have been used by others to measure the impairment. One of them is the CGAS, which is the Children Global Assessment Scale, did by Schaefer and his group, and been used in different studies. Another instrument is the one developed by the WHO, and that's the X66 of multi-axis scheme, MAS, which run on that. It's you rate the impairment from 0 to 8. For those who are, I don't know if you're familiar with the CGS, it's a scale where you after you do the assessment in all child living spheres, you rate him from 0 to 100, being 0 is the most sick and 100 is the most healthy child. According to DSM-4, a cutoff point of 60 on the CGS indicating a level of clinical impairment that require treatment. And if you translate that, it means that the child has at least 5 symptoms.